Could something as innocent as cannabis be the difference between a happy and fulfilling life versus a lifetime with a serious mental illness and powerful psychiatric medications? Well, that's what we're going to be talking about today. For those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist, and I help people safely come off psychiatric medications, especially when they've been misdiagnosed. So I want to start by talking a little bit about my childhood. Now, I grew up thinking that cannabis really wasn't a big deal, and I think this came from things like movies we used to watch. I mean, we used to watch Pineapple Express with Seth Rogen and James Franco, and it was just a laugh, and it was really funny. And I really didn't think too much of it back then. And at that time, I used to smoke a little bit of marijuana with my friends as well. And we'd often buy little baggies from our friends and we'd smoke a little bit of pot. And it seemed fun and that it wasn't a big deal. And I even remember, my friends would roll joints and sometimes they'd forget to pick all the seeds out and we'd have some of the joints kind of pop and explode when you'd smoke them. And this was all signs of smoking sort of low quality weed that was grown in someone's backyard. And that was really what it was like for us back in the day. But what I've begun to notice more and more these days is that that's really not the weed that we have anymore. And my first experience with that was when I was coming to the United States. And I was there with some friends. And this was around the time where cannabis was legalized medically in California. And my friend went into a cannabis dispensary and, within about 15 minutes, he walked out. He probably paid like $200 and we got a card. And we went to one of these shops and we bought a joint. And I remember smoking it with him and being absolutely floored. I was completely non-functional. And that was the first time that it hit me that cannabis has changed a lot. And the potency is just way different from what it used to be. And, I'm 34 now, so I'm kind of old enough to have seen some stuff. And I can look back at some friends of mine who were heavy pot users and their life really wasn't the same after they started this. So this friend of mine who had a psychotic episode when he was 22, he was never quite the same again. He ended up on antipsychotic medication and I think he continued to use pot and his life went in a very different direction where I think he's now still quite disabled. Now, the longer that I've been a psychiatrist, the more I've seen, and I'm convinced that cannabis can actually be neurotoxic to the brain for some people. Some researchers say that it can unmask schizophrenia, but I don't really believe that in all cases. I actually think that strong weed, especially high potency weed, can actually damage the brain and it can induce something that looks like schizophrenia or it looks like bipolar disorder, and that is being missed. Because when I talk to experts in this place, they tell me that the strength of the THC in cannabis has gone up nearly 40 times for some products, especially if you're talking about things like dabs and shatter, which is ultra concentrated cannabis products. And so because of this and what I'm seeing, I'm particularly worried about the influence of big cannabis now. So now, as you might have been aware, multiple states have now legalized recreational cannabis, and there's a big industry around it. And with a big industry comes marketing and a lot of the same practices that I see in Big Pharma. If you're new to this channel, you may not know that I am very critical of the pharmaceutical industry, mainly because they have this agenda to make people see their products in the best possible light, which really means they overhype the benefits and they minimize the harms. And I'm worrying that the exact same thing is happening in big cannabis now. Because there's so much money in there and there's such an industry, that again, the benefits, that they can help with pain and can help with psychiatric problems and sleep are being overhyped, and actually the harms that it can cause, serious neurological problems and potentially psychosis is being completely minimized. Now, I see this in just like general attitudes towards people who have a problem with cannabis. I feel like they're often cast as these stodgy conservatives who are just, they just don't like drugs and they just never will, and they're just closed off to seeing the benefits about that. But I don't really think that's the case, and I think there's more to this. And I want to be really careful about this, and I want to kind of tiptoe around it because I know there's a lot of people out there who may be benefiting from cannabis right now, or who have fought hard for cannabis to be recreationally approved, and they think it has a big role in pain. And it may be a better option for some people if they're going to use cannabis instead of opiates for their pain. And I do also want to say that the risks of cannabis tend to be especially problematic in the younger generation of people who are using it before their brains have fully matured, which typically happens, well into someone's 20s. And so I do think that cannabis is not as big of a problem for people who are over the age of 30 and are only using it recreationally. But where it really concerns me is, again, in children and adolescents. And that's where most of the research is showing that this drug can be very dangerous, and it can actually cause psychotic illness. Unfortunately, young adults, late teens, early 20s, this is the biggest group who are picking up cannabis use at the moment. And they are the ones who are at the most risks. So let's transition now. And I want to talk about how I think cannabis can be a gateway drug into the psychiatric industry. Now, many of you have probably heard of bad trips happening with cannabis. So you could have like 10 people sitting around in a room, everyone kind of smokes some, people are giggling and laughing and having a good time. And then you have this one person who's starting to become a little paranoid and self-conscious, and they feel really, really bad. Now that is a bad trip. Now, most people think these bad trips on cannabis, they'll maybe last a couple hours, maybe a day or so, and then you come out of it. That's not what I'm seeing clinically. In fact, back when I was a resident, I used to see people, especially those using dabs or high potency manufactured cannabis products like Delta 8, which is just like a chemical they would spray on herbs that was super high potency THC. Some people would smoke this and they would be psychotic for months sometimes, aggressive, manic, and they would need heavy amounts of sedation to even manage them. And since then, I've been studying what happens after some of these severe bad trips. And some people, they say that it can take them a year or even 2 years to feel fully back to themselves after they have a really severe bad trip on cannabis. Now, these were a lot less common back when the potency of the cannabis product was like 0.5% to 2%, like the old sort of bush weed. But nowadays, where we have like dabs, which are like 40%, and even some synthetic cannabis products that are even like 90%, 100%, people are much more likely to have these severe bad trips that go on for a really long time. Now, this is really important because this leads to like a pivotal moment in what can happen in your life. So there's two things that happen after someone has one of these more severe drug-induced psychosis. They can go and they can see a doctor, and the doctor could say, well, you're using cannabis products. It has unmasked your schizophrenia. We knew that would happen. And, it's just clear that you have schizophrenia now. And so they'll say, you should, avoid cannabis. But we're going to give you antipsychotic medication, essentially. And this is just your lot in life. You're genetically unlucky and you have schizophrenia, and now we're just going to manage it. Unfortunately, with these patients, sometimes they keep on using cannabis products. The sense in the air of, hey, it's not that big of a deal, and I would have developed schizophrenia anyway. Maybe there's some addiction going on. Who knows? But many people who have these drug-induced psychoses and go on to get schizophrenia, and many people can continue to use cannabis, and it can just simply perpetuate their psychosis without them realizing how big of a deal it is playing with them. Now, what I'd like to do is contrast this sort of unmasking of schizophrenia situation with a brain injury model. And this is what I think is really happening. And it leads to very different treatment, because if you are someone and you are using high potency cannabis products and you have one of these severe psychotic episodes, a lot of doctors can be really quick to say, well, if the psychosis is going on longer than 2 weeks, the drug is out of your system, well, you must have schizophrenia. I don't think that's true. I actually think there is evidence now that these drugs harm the brain. And so even in those cases, if you look at it more like a drug-induced injury, you may need to get on antipsychotics in the short term if you're very aggressive, but the way you view the condition is different. You view it more as an insult to the brain that has resulted in psychosis and mania, and then you have to give yourself time essentially to heal from this. And when you look at it this way, as your brain was very susceptible to cannabis and it got hurt, I think it puts additional emphasis on how important it is to avoid this drug, because there's clearly something about your brain that when it gets exposed to cannabis, it's harmed it. And now you're developing psychosis and behavioral problems. And this is really important because it can set expectations for the patient and their family that, yes, you looks like you've had one of these drug-induced psychosis. It's probably going to last for a while your brain heals. We're going to monitor you. We're going to support you. But we're going to be hopeful that this is going to go away. And for many patients, it may with good support. And if it doesn't, only at that time should you default back to thinking that maybe you have schizophrenia and you need to be on medications long term. Unfortunately, many people are robbed of that opportunity to see if they would just get better with sobriety because they get told that they have this psychiatric condition, schizophrenia, and then they get put on antipsychotic drugs. Now, if you are put on these really quickly at the start and there is not a plan to remove them, your brain becomes very dependent on them. And then what I see later on is, maybe someone's had one of these drug-induced psychoses. 2 years later, they decide they want to come off. Their brain's fully dependent on it. And if they taper themselves off the medication too quickly, they induce a psychotic episode. Not because they have schizophrenia, but because they go into severe withdrawal. And so essentially you have this time-limited event, which now leads to a person being unable to come off an antipsychotic medication and potentially thinking that they have a permanent mental illness when they don't. Now, another thing I want to be careful about is being too dismissive of simply how hard it can be to come off cannabis for people, even those who have had these neurotoxic reactions or they've unmasked schizophrenia. Believe me, I know cannabis addiction is a big deal, and a lot of people start using it to deal with anxiety and insomnia. And one of the worst things is when you have someone addicted to it who's using it to soothe emotions, and then they start to develop a brain injury and they start to have psychosis and high anxiety and agitation. And it's caused by the cannabis, but the only coping mechanism that the person has in their life for dealing with these things is essentially smoking more cannabis. So you've got a drug harming the brain, making them worse, causing more anxiety, and then they're trying to soothe it by using cannabis again. And this is what makes this drug so destructive, and it's so destroying to families, is family members will watch someone who's clearly doing poorly on it, and they simply cannot stop, and they're making their brain worse and worse and worse. So I've given you my download on cannabis and what I've seen clinically, but I always think it's good to back this up with some research that supports some of these concerns. And so the first study I want to look at was one by Meyer et al., and they did a prospective cohort study of 1,000 people from birth to age 38. And what they found was that persistent cannabis use was associated with neuropsychological decline across multiple cognitive areas. It wasn't just one, it was multiple cognitive areas. And these deficits were concentrated in those who started using cannabis as adolescents. And they even found that the people who stopped using cannabis, they did not fully bounce back in terms of their neuropsychological deficits. Now, if this isn't proof that these drugs are more dangerous in young people with developing brains, I don't know what else you need to see. And the fact that some of them aren't bouncing back after they develop these deficits really speaks to the fact that there could be some neurological damage actually caused by using cannabis, especially when you are younger. Now, the next study I want to look at was one done by Kaiser Stase and his team. This is a Danish registry study, and they followed 7,000 individuals diagnosed with substance-induced psychosis over 20 years. And the overall conversion rate to schizophrenia or bipolar was 32.2%. And so just want to flesh that out. So they found 7,000 people who had a substance-induced psychotic disorder. And so these are people going to emergency rooms because they are having a bad trip on cannabis, LSD, cocaine, things like that. And 32% of those would go on to develop schizophrenia or bipolar later on. However, here's the interesting thing here. Amongst those who had the cannabis-induced psychosis, 47.4% of them later developed schizophrenia or bipolar. Now, this was a higher rate of conversion than any other substance-induced psychosis. For instance, those who were on hallucinogens, they converted to bipolar schizophrenia at 32%, around 16 points lower than those on cannabis. Those who had amphetamine-induced psychotic disorder converted at a 20% range, and those who were on cocaine and were having problems with that, they converted at 19%. So to me, that's really surprising because I think a lot of people would think that people, getting high on hallucinogens, on methamphetamine, they would have the highest risk of this kind of damaging their brain and them looking psychotic later on and getting diagnosed with schizophrenia or bipolar. That's not the case. It's actually cannabis which is the most dangerous. If you have a cannabis-induced psychotic episode, nearly 50% of people go on to get a schizophrenia or a bipolar diagnosis later on. This is really serious, and so serious that I would say if this ever happened to you, you should stop using cannabis forever because it's incredibly dangerous. Now, finally, let's look at this meta-analysis by Ariana Marconi, who was looking at whether higher rates of cannabis use were associated with worse outcomes. And so she did a logistic regression where she got all of the people who were using different amounts of cannabis, and she wanted to see whether, more cannabis is associated with higher rates of conversion to schizophrenia. And she found an odds ratio of 4 for those who are using the most. Essentially, among the heaviest cannabis users compared to non-users, you are actually 4 times more likely to develop schizophrenia. And so those are some of the most substantial papers that really shed light on this risk. Now, I want to speak to the person out there right now who may be watching this, who's had a cannabis-induced psychotic disorder before, or who may be diagnosed with schizophrenia. You have to find a way to stop using cannabis, because you may well have a nervous system sensitivity or even injury from the cannabis already. And so I work with a lot of people who have drug injuries. I treat a condition called protracted withdrawal. And essentially, after you've damaged the brain or you've harmed it and it's really sensitive, every time you expose it to another insult, it's almost like taking another hit to the brain. And I often use the analogy of football players who have CTE, or chronic traumatic encephalitis, which is a form of traumatic brain injury. And I tell them, if you've had this injury from this drug, if you expose yourself to further things that are going to damage your nervous system, each time that happens, it's almost like that football player getting one hit, then another hit, then another hit. And before you know it, the football player looks like they have dementia. This is the same thing with drug injuries, and it's the same with cannabis. If you keep on exposing yourself to cannabis, it's just one hit after another after another. And before you know it, you're going to have worse and worse psychosis, and it's going to take a longer and longer time to heal. So you have to do whatever you can to stop using the cannabis products. On that note, I'm going to wrap. If you want to learn more about the impact of cannabis-induced psychosis on people and their families, go and check out the Every Brain Matters YouTube channel by Audrey Adams. It's an awesome resource. And finally, what I want to ask you to do is for you to tell me about your experience with cannabis-induced psychosis and whether it led you to getting misdiagnosed with any psychiatric conditions. Please tell me about that in the comments below this video.